Hello, my name is Vince. I'll be your nurse today. Before we get started, let me just wash my hands for 20 seconds. So I understand you do have a tracheostomy, so you have some trouble speaking. So just give me a thumbs up as a way to say yes. Give me a thumbs down as a way to say no. And raise your hand if you're feeling any pain or discomfort, okay? Thumbs up. Is your name Joe Joestar? Thumbs up. Is your date of birth 1/1/1969? Thumbs up. Okay, and do you have any allergies? Thumbs down. Okay, any pain today? Thumbs down. Okay, I'm just going to double check with your wristband. Okay, the information matches. Well, today I'm just going to be doing some tracheostomy care on you, such as sectioning out secretions, replacing your inner cannula, cleaning the surroundings of your tracheostomy, cleaning the faceplate, placing split gauze underneath the faceplate, and replacing the stabilizer. Have you had any of this done before? Thumbs up. Any pain or discomfort when you had this procedure? Thumbs down. Do you have any questions or concerns so far? Thumbs down? Okay. Well, I'm just going to take a look at your vital signs. Okay, so I noticed that they're all within normal limits except for your respiratory rate, which is slightly high at 22, and your O2 saturation, which is slightly low at 93%. So I'm going to have to hyperoxygenate you before we start suctioning. Are you experiencing any shortness of breath right now? Thumbs down. Any cough? Thumbs down. Okay, so I'm observing no extra respiratory effort. So I'm just going to take a listen to your lung sounds now. Give me 6 breaths when you're ready, okay? Deep breath, deep breath, deep breath, deep breath, deep breath, and deep breath. Okay. So I hear some secretions, so we're going to have to suction you. But before I suction, I'm just going to do an emergency supply check. So I see that I have an ombu bag right here at 100% oxygen at 15 liters, which is the maximum. I have 1 extra inner cannula, 2 trach boxes. One is the same size, a size 8, and one is a size smaller, a size 6. And I have a suction catheter that is connected to a suction canister. Okay, all my emergency supplies are there. I'm going to do hand hygiene one more time. Put on a pair of gloves. I'm going to wipe down the table for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, now that it has been 30 seconds, I'm going to dispose of my wipe, dispose of my gloves, perform hand hygiene for 20 seconds, and I'm going to let the table dry for 2 minutes. While the table is drying, I'm just going to put the patient in high phallic position. And I'm going to close the door and close the curtains for the patient's privacy. Okay, now that it has been 2 minutes, I'm going to perform hand hygiene one more time. I'm going to get all my materials. I'm going to go ahead and replace the suction catheter because we don't know when the last time it has been replaced. And we just want to be as clean as possible. Okay, the new suction catheter is on. I'm just going to change the setting to 120 milliliters of mercury. I'm going to check that the ombu bag is again at maximum, 15 liters, 100% oxygen. I'm going to test the function of the ombu bag. Ombu bag is fully functional. I'm going to check the O2 source. It's at 5 liters, exactly what the doctor ordered, and it's running into the trach. It's fully connected. Okay, everything looks good. So I am going to remove my gloves. Hand hygiene one more time. kit. So I don't need this, so I'm gonna go ahead and remove it. So I don't need the sterile gloves, so I'll go ahead and remove that. I'll grab the drape by the 1-inch border. I'll go ahead and lay it on the patient. Okay. Then I'll grab my inner cannula. Drop into the kit. Dispose of the packaging. I'll go ahead and move the kit over. I'm going to remove my dirty gloves. Hand hygiene in 20 seconds. I'm going to grab my sterile box. Open it up. I'm going to pour some saline halfway. We'll pour some saline halfway. Okay. Now I'm just gonna test the function of my catheter. So okay. The catheter is functional. I do see that the pressure went up to 180. So I'm gonna adjust it back down to 120. Okay, so now I'm gonna hyperoxygenate the patient. So I'm gonna go ahead and remove the O2 source. Give 3 breaths, 6 seconds in between. 1 breath, 1, 2, 3, 4, 5, 6. 1 breath, 1, 2, 3, 4, 5, 6. 3rd breath. Okay. So now I noticed the oxygen saturation of the patient went up to 99%, which is good. So now I'm going to begin with suctioning the patient. Any questions or concerns before we start suctioning, sir? No? Okay. So I'll go ahead and... Okay. Okay, how are you doing, sir? Good? Okay, and do you feel like you need more suctioning? No? Thumbs down? Okay, so if I were to suction this patient again, I would have to wait at least 30 seconds before suctioning again. So I'm going to do an observed respiratory assessment. So I noticed that there are no signs that indicate a need for more suctioning. So I'm going to put back the O2 source now. And I'm going to move up the sterile drape so we can prepare to replace the inner cannula. So I'm going to remove these gloves, hand hygiene one more time. Put on a pair of new gloves. So I'm going to go ahead and move my kit closer to me. So I'm going to remove the O2 source. I'm going to hold the faceplate. I'm going to remove the old cannula. I'm going to grab the new cannula. And I'm going to make sure it clicks in place. Click. Okay. New cannula is now in. So now I'm going to remove the split gauze. Okay, now I'm going to do a peristomal site assessment. I see that there's no redness, swelling, or signs of infection. There's no cracking of the tubing, and the tubing is intact. Okay, that is good. Now I'm going to grab Q-tip, Dip it in the saline. One swipe underneath. Dispose. Dip it in the saline. One swipe underneath, but on top. Dispose. Dip it in the saline. One swipe underneath. Dispose. Dip it in the saline. One swipe on top. Dispose. Dip it in the saline. Go ahead and clean the faceplate. Dispose. I'm gonna dry you up now, okay? Any pain or discomfort so far? No pain or discomfort? Okay. Dispose. Grab the old split gauze. Or the new split gauze, sorry. Go ahead and put it under. Okay, new split gauze is in place. So how are we feeling? Good? Good? Okay. So no pain, discomfort, anything? No pain or discomfort, thumbs down, okay. So now I'm just gonna dispose my sterile field. Put the O2 back on. Great, and now I'm just gonna remove any secretions from my suction catheter. Okay, suction catheter is now clean. And now I'm just gonna clean up the rest. I'll leave this. I'll go get a second nurse so we can change your stabilizer. But let me just clean up. Okay, so I'm gonna go get a second nurse. That'll help me change your stabilizer, okay? So any questions or concerns before I go get that second nurse? Thumbs down. If you have any questions or concerns, please hit your call bell. It's right here next to you. Okay, I'll go get that second nurse. Hello, my name is Vince. I'm back with the second nurse to change your stabilizer. We're both gonna perform hand hygiene for 20 seconds and put on a pair of clean gloves. Okay, so I'm just gonna move the O2 source, and I'm gonna have a second nurse stabilize for me. And I'm just gonna remove. I'm gonna remove the old stabilizer. I'm gonna check the site. There's no redness, swelling, or signs of infection. There's also no signs of pressure source, which is good. Okay, I'm just gonna put the new stabilizer on. Okay, now I'm gonna stabilize. How are you feeling so far? Good? Okay. Okay, and now I'm gonna do a fit check. Okay, only 2 fingers fit, so the fit is proper. So how are you feeling after the new stabilizer's on? Thumbs up. Is it comfortable? Thumbs up. Okay, any pain? Thumbs down? Okay. Well, I'm just gonna check your vital signs one more time. Okay, everything is within normal limits. The O2 is 98%. The respiratory rate is 17. Any shortness of breath? Thumbs down. Any pain or discomfort, once again, thumbs down. Okay. So I'm going to change my gloves, hand hygiene. Do you mind if I take a listen to your lungs one more time? Thumbs up? Okay. Okay, 6 breaths for me, okay? Take a deep breath. 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 Okay. The lungs are clear bilaterally. Now I'm just gonna make sure that all the emergency supplies are at the bedside. So I see that there is a suction catheter that's attached to the suction canister. I see all my other emergency supplies. So do you have any questions or concerns so far? No? Okay. Well, at this point, I would remove my gloves, perform hand hygiene, and now I'll document the date and time of the procedure, patient tolerance, peristomal site assessment, respiratory assessment, vital signs, and O2 saturation before and after the procedure, color, consistency, and amount of sputum. So do you have any questions or concerns? Nope. Okay, I'll just leave your call bell right here. I'll put your bed in the lowest position. I'll put your side rails up for safety, and just hit that call bell when you need me, okay?